May I call Dr. Huda, the Chief Technical Advisor to Saudi Food and Drug Authority, who has specially traveled here to Geneva to address this forum. Dr. Huda.
Hello, everybody. Thank you so much for this opportunity. Hello, good to see you, Prof. So I really want to take this opportunity to shed light on digital health in conflict-stricken zones and crises, and just having really a hands-on experience with that for Sudan specifically. We have SAHATI.ai. We have a great technology to be able to deliver healthcare and also educational material during and beyond the conflict. And I think everybody has probably seen or heard about the war and the atrocities and just the sadness of it all. But the fact that we have a tool, not a standalone solution, but a tool that really needs to be presented as a basic pillar of health systems around the world, especially in the Southern Hemisphere. I think we take it for granted in the Northern Hemisphere. We have technology, we have innovation in AI. But in the Southern Hemisphere, it really does save lives. We were able to work with different diaspora, Sudanese diaspora doctors from all over the world to provide healthcare on this platform for free so far since 2021, it's 110,000 patients. We have the core, over 200 doctors, 20 different specialties. During the conflict, so we started before the conflict, but during the war, they were able to actually help via video consultations in hospitals where 70% of our healthcare system was down, bombed. Literally 60 to 70% of the hospitals were bombed and not safe for patients or healthcare workers to go there. The healthcare workforce was being attacked by the militia. Women were being raped and children were going through trauma. So there was a protection aspect working with the international health community, protection in terms of gender-based violence and trauma, etc., in terms of working with maternal care and women and what they had to go through. But these doctors online were able to be present and help deliver babies using local medical students, anybody we could find locally that can help women trapped sometimes under the rubble and also in hospitals for surgical interventions, to be able to lead whoever had the slightest amount of clinical knowledge to be able to help patients. So we really got to see on the ground, on site, what we could do with digital health. Unfortunately, I think our biggest challenge was not even infrastructure. It wasn't about that our internet was down and people didn't have access to the hospitals. Because a lot of people were on Facebook, a lot of people were using WhatsApp, so it wasn't really the infrastructure. It was more the awareness, and I say that there's this myth that clinical intervention is priority and is the most important thing. I think when it comes to conflicts and crises, it's not. Because a lot of these times, that's not even an option. The only option is the digital care. And so it does save lives. We know all that. I don't want to go over what everybody already knows and has talked about. But I wanted to paint a picture of what conflict and crises look like in real life in Africa, in a low mid-income country, with tons of people who are willing to be volunteers and work and provide health, but to have the limitation of awareness from the patient perspective, the community level, as well as the providers. So we really need to raise that awareness. And not only that, the international health community, the WHO, Celine, I just want to highlight that because I think even we are official partners with WHO and UNICEF in Sudan to provide care, yet digital health is not a priority. So it's not a priority. It's not the myth that I would like to eradicate. I would like this unit to work with us to help eradicate the myth that clinical intervention is the only option and that saves lives. No, it's not. Digital health is right up there. And we need to look at it as such. It is a basic pillar in health systems. It should be. It should also be, it should also have a ratio as a basic pillar, should have a ratio of the budget going to health systems. The GDP that's 8 or 17%, whatever it is, some of that needs to go to digital health, because otherwise we don't get funded and nobody takes us serious. And that's the issue. It's like having penicillin but holding it back from everybody who needs it. And we just can't do that. I take that responsibility personally, that we need to be up there in terms of priority, in terms of being a basic provision of health, and in terms of getting the funding. So in all kinds of ways, it's not about the infrastructure, and there's other ways that we can help. I wish that we could also talk to not just the international community to get us there. Oh, before I get to that, what we could do about it. Governance was another issue, because we had a lot of migration. As a result of the conflict, a lot of the people, it is one of the biggest migrations in the world. 8 million people were displaced internally and cross-border. And working cross-border, it was really difficult to reach people, not just in the remote rural areas, but the cross-border was even worse. We can reach people, they have Wi-Fi, such as people in Egypt or Uganda or Ethiopia or Kenya, but the governance, these countries had different policies, if they had any policies. So I think one of the things we should walk away with is talking about, what do we do when there is no policy, no regulation, or people don't know anything about cloud? What do we do? Do we use GDPR because that's patient-centered versus HIPAA? Do we put out a word via the international health community, because they're the ones that have a voice? Do we put out a word that countries without regulations should default to GDPR? And do we all adhere to that? How can we hold them accountable? What indicators can we use, etc.? Also, when a health system is in collapse and nobody can reach anybody to do anything, how do we have that two-way communication between health authorities and patients needing the care? And when the health information system is also down, how do you collect the data and bring it up to humanitarian aid so they can quantify the gaps, the needs, and the response? So all of these issues are very well solved via digital health, and that's why I just wanted to paint a picture of another on the ground, on site, of what digital health looks like and what we can do about it. So governance, funding, and being a basic pillar, and now I forgot my third point. All right, let me see. So universal care, governance, the GDPR for governance. Yeah, the cross-border. So having these countries collectively work with us in governance, in funding, and in having digital care as a universal standard of care. Thank you very much. I hope we all remain in touch via WhatsApp or something so we can keep moving. Thank you.
Thank you, Dr. Huda. And when she came in, we were talking, and she was telling a very, since she's grounded in the reality of where the conflict zones are, that in the times of conflict and migration, the only option is digital health, nothing else. And at this time, there are 50 countries in conflict. So you can understand why this movement, digital health science borders, is important.